Hi, today we're going to be talking about in vitro maturation, or IVM, which is an up-and-coming infertility treatment that's starting to be used by infertility clinics in the United States. However, it is not yet widely used, and a lot of people do not know very much about it. Infertility is a problem that a lot of people deal with. 1 in 8 couples in the United States will suffer from infertility in their lifetime, and a lot of these couples will need to use some form of assisted reproductive technology, or ART, in order to conceive. ART consists of surgical procedures that help couples who cannot conceive naturally to have a baby. In vitro fertilization is currently the most common form of ART, and it's widely used by a lot of fertility clinics, and it's a very effective method. However, it is really expensive. It costs $15,000 to $20,000 per round of IVF, and a lot of couples will have to undergo several rounds. And it also involves a lot of extensive and intense hormone therapy that is really taxing to the patient. And so the reason we're talking about IVM today is because it presents a possible alternative to IVF and a way for people who can or can't or do not want to undergo IVF to have some form of infertility treatment. And this is especially important right now because it could possibly be an infertility treatment option for you when you guys start thinking about having kids, because it's so up and coming right now. In this presentation, I'm going to be talking about the steps of IVM and what it looks like, the pros and cons of IVM, as well as who IVM could potentially benefit. So these are the steps of IVM. It starts with 3 days of FSH therapy, and FSH is a hormone that stimulates the follicles or egg sacs to grow so that it's easier to remove the eggs from the mother surgically, and that's the second step. And something that's unique to IVM is that the eggs are removed from the mother when they're immature, and in IVF they're removed when they're mature, which is why women have to take so many hormones in IVF. And then once the eggs are removed, they're placed in a dish and matured, and then combined with sperm. And once the sperm fertilize the eggs, 1 to 3 of these embryos will be transferred into the patient's uterus. And so IVM works because it takes away a lot of the intermediate steps that often go wrong when people are trying to get pregnant naturally, such as the sperm reaching the egg. And so by making that happen, instead of hoping it happens, it really reduces the chances of the couple not getting pregnant. So IVM offers a lot of really unique benefits over IVF. First of all, it's a lot less expensive. It costs $5,000 to $7,000 per round, which for an infertility treatment is not very expensive. It's less than half of what IVF costs. It's also a less taxing and stressful experience for the patients because it only involves 3 days of FSH therapy, whereas IVF requires about 2 weeks of hormone therapy, and the hormones act directly on the ovaries, which is a more uncomfortable experience for the mother. Because the hormones used in IVM do not act directly on the ovaries, they do not increase a person's risk for OHSS, which is ovarian hyperstimulation syndrome, which is a medical condition that harms women's ovaries, and IVF is known to cause OHSS. So that's one pro of IVM, is that it does not increase the risk for OHSS at all. And then finally, IVM can be performed urgently because it does not require extensive hormone therapy like IVF does, and IVF also requires another drug to suppress the patient's normal menstrual cycle that IVM does not require. So IVM can be performed a lot more last minute than IVF can. Although it has some really great benefits over IVF, there are also some costs associated with IVM, which is that the main one is that it has a lower live birth rate than IVF does. The IVM live birth rate is about 22 to 29%, whereas with IVF it's about 40%, so that's a relatively big difference. And the live birth rate is basically just the percent of women who undergo IVM that actually give birth to a live, healthy baby. And some studies have also shown higher rates of chromosomal abnormalities associated with IVM, so that's another drawback. So this graph just summarizes some of the key differences between IVF and IVM. As you can see, both of the procedures have comparable pregnancy rates, but the live birth rate for IVF is higher than for IVM. However, if you look at the likelihood of getting OHSS, IVF increases this likelihood by 10%, whereas IVM does not really increase it at all. So clearly there are some pretty serious drawbacks associated with IVM. However, it does make infertility treatments an option for a lot of groups that it is not an option for right now. One example of one of these groups is patients who have polycystic ovary syndrome, or PCOS. And PCOS is basically an endocrine system disorder that's really common in reproductive age women, and it puts them at a very high risk for OHSS. And so if women who have this disorder get IVF, it becomes likely that they will get OHSS, which is really dangerous, and so they can't undergo IVF. But because IVM does not increase the chances of getting OHSS, IVM is an option for these women. IVM is also an option for cancer patients. Cancer treatment often makes women infertile, but because IVM can be performed urgently, women can undergo IVM before they start cancer treatment, and then they can either freeze their eggs or their embryos until they're done with treatment so that they have an option for getting pregnant later. Whereas IVF takes so long to start and plan out that it would be risky to postpone cancer treatment for that long. So IVM makes fertility treatment an option for women with cancer. It also is helpful for patients who have financial limitations and simply cannot afford IVF, which is a lot of patients because IVF is so expensive. So it opens up infertility options for people who cannot afford IVF. And it also gives patients who just don't really want to undergo that extensive hormone therapy an option. So now that you've heard a little bit about IVM, you can start thinking about its drawbacks and also its advantages, and thinking about whether or not it might be worth it for this to become implemented in a lot of fertility clinics. It's really important for us to be thinking about these issues because it is likely us who will end up having this option as a possible infertility treatment in the future. And so I hope that I was able to present some valuable information about IVM, and thank you very much for your attention.